And this week, we have Dr. Mike Morris presenting his True Comprehensive Care. So Dr. Mike Morris is originally from South Florida, where he studied microbiology at the University of Florida. He took a year off and lived in Salt Lake City, Utah, where he hiked, camped, and learned how to ski. Good place to learn. Dr. Mike then graduated dental school from the University of California at San Francisco, where he learned to love wine. Finally, he completed an optional year-long residency program to advance his skills at the University of Alabama at Birmingham. Dr. Mike loves to constantly learn and advance his dental skills, but when he takes time off, he enjoys cooking, traveling, hiking, and skiing. I bring you Dr. Mike.
Good morning, everyone. Thanks so much, Jim. Really appreciate that introduction. I think that one of the things that helps me do what I do is just loving what I do. It's so easy because when you love what you do, it makes it really simple. So I just have a really quick little blurb of a song from one of my favorite artists, Lenny Kravitz. I hope it plays. I hope it comes through this. Just a few seconds long, just to get us going. I let love rule what I do every day. And I think that's what really helps. And so I'm going to share with you a really quick story. And then I've got a patient that I want to introduce to you who's very special to me. So, the reason why I got into this type of dentistry, I had a patient ask me actually on Wednesday. She said, "What kind of dentist are you?" And I said, "A general dentist." And she said, "No, what you do isn't the same as everyone else." And I said, "I don't know. I just love what I do, And so I really had no answer for her. I just learn a lot, and it's very personal to me, this certain aspect of my practice I'll share with you today, because I'm a patient too. So I have Invisalign trays in right now. That's why my teeth look a little funny. And prior, I know that anyone who's been in this chapter saw me with a dental orthotic. It's a bigger kind of plastic thing that was in my mouth. I woke up one day with my jaw locked and I had to shut my practice down for the day. So that was kind of a wake-up call for me. And that started this entire learning process for me to allow me to actually do what I'm going to show you that I've done today for this patient. And so I'm a patient as well. So it's very personal to me. So given that, could you go to the next slide, please? So this is my wife, Allison. On the left, this is the way that she looked after her orthodontics. I don't actually have a great picture of her before orthodontics, but she had orthodontics. And she still had some issues. If you see her chin kind of off to her left, her smile's a little flat, and her lip sort of has a asymmetry to it. Now, if you look on the right, that's actually a dental orthotic. So she's actually wearing an orthotic on her upper jaw, and it's got teeth built into it to lengthen. And I'll show you kind of what I mean by that here in a slide or two. And so if you look at her posture, see the way her head has lifted, see the way her eyes are more level, see the way her chin is more level, her lips. So when I say true comprehensive care, we're going above and beyond the standard of care, which is teeth and gums. So I'm going to show you more about what I mean by that in the next few slides. Could you go to the next slide, please? So that's the orthotic gone, and this is material actually bonded to her teeth. So this is her finished smile. So I wanted to show you the beginning and then the end. So we start off with the orthotic, and that's how we gain sort of a good diagnostic process of where should we put the teeth, how should we shape them, what should these be like. And I've got a closer up photo so you can appreciate kind of the minutia of her smile. But what stands out to me is looking at her posture. She's so much more kind of proper. She sits a lot straighter. There was no postural coaching. I just took photos. I didn't even tell her, just smile, I took a photo. So her chin, again, look at the way her chin is more centered, the shape of her face, the muscles, everything are more relaxed. You see how on the left, her cheeks look very kind of square. That's from her muscle tension, and all that muscle tension has relaxed. Next slide, please. So that's a close-up view of the actual additive. You can see it's not a lot, but she had pretty moderate wear. And this wear is not just affecting her teeth. as you could see in the prior photos with her posture changes, the facial shape changes, teeth and wear on teeth can be indicative of other issues. It's sort of like I've heard even patients say that, you know, the mouth is sort of like the gateway to the rest of the body, and it actually is. Actually, the face and mouth are the first things to form that even look human at about 6 weeks in utero. So our lips and our tongue are the first human thing that develops in our bodies while we're actually in gestation. So it means something. It's very important. So we're looking at a lot more than teeth and gums in our practice. So I'll show you a little bit more. I think this will really be good for you to help and understand. Next slide, please. So on the left is her lips at rest before I added the material. At right is the lips at rest after I've added the material to her teeth. There's nothing done to the lips. There was no Botox. There was no snake venom, anything like that, okay? This is just restorative dentistry. I mean, you know, I'll go ahead and say, hope I don't weird anyone out, I would much rather kiss the lips on the right than the left, okay? It's my wife, okay? So the lips are a lot better, right? I mean, that's the thing that we can do if we pay attention to it, if we are trained, if we understand this. They don't teach this in dental school, okay? This is not something that's the basic premise of dentistry. These are advanced skills that I've learned over time from a lot of continuing education and good mentors. So next slide, please. I could spend a lot of time on this slide, and I don't want to. I just want to really quickly point something out. Okay, this is a slice from a 3D image. So in order to have done all that we did, there's a lot of background work and a lot of thoughtful process information gathering. So these are 3D slices. So this is actually a slice going straight down. They call it a coronal slice. Like if you were to put a crown on your head, that slice goes straight down. So you're actually looking like you're looking right at her face. And this is her maxillary sinus. It's the sinus cavity of air behind the cheek. And so on the left are her sinuses before we did this treatment for her. On the right are her sinuses, and those orange arrows point to the change. If you see that kind of gray blobby looking stuff, that blobby looking stuff is actually inflammatory mucosa, inflammatory tissue inside the sinus, okay, that has improved with the treatment we did because it helped her breathe better. It helped to lower the inflammation in her body. It helped a lot of different things, but these are the things we track, and this is what we look at as we do treatment. We're constantly monitoring all of these things. If you think this slide is interesting, could you go to the next slide, please? Now I could spend 10 minutes on this slide, and I'm not going to. Okay, I've given myself about a minute. So this very simply is her airway, all right? This is three-dimensional rendering of the space where air goes when she breathes in her nose before it goes down into her lungs. We call this the upper airway. Okay, on the left is before treatment, on the right is after. Very simply, if you look at the numbers, they've increased. The red there in the middle has decreased. Blue is really good. Blue has increased in the color there. That's the width and the sort of the volume of her airway. What this means is humans are the only species, besides bulldogs, interestingly, that have a fully collapsible airway. Our airway is supported by soft tissue. So if we're allowed to relax that muscle around the airway, if we're allowed to relax everything, the airway expands. And that's what happened. And I can get into more minutia, but I won't. The shape of the airway is important as well. And that also improved with her. What does this mean? What this means is she said, and I quote, I'll read it, "I've never slept better. Wow, I can't remember the last time I slept through the night." This is what this means for her, okay? And this is what we can do. And I would have put up sleep studies. We have sleep studies too, and there's lots of information on those, but that would take 10 minutes to describe as well. So we've also done sleep screenings on her to track and monitor her progress. So a lot of comprehensive thought has gone into this true comprehensive treatment. Next slide, please. I've left very little time. I might have 20 seconds, 30 seconds.
Yeah.
So if anyone has any questions, feel free to reach out to me. I would love to connect, and I appreciate your time. I hope this was interesting for you. Thank you so much.
Really fantastic presentation. Thank you so much, Dr. Mike. And I think we should all give him a round of applause for this.
Yeah, great job, Mike.
Thank you, guys.
Yes, and please all schedule one-to-ones with him. I'm sure he has a lot more information to share from what we're seeing here. So fantastic job. Thank you again.
Thank you. Thank you, guys.